Good morning. My name is Doug Corsi. I'm a fourth-year medical student at Sidney Kimmel Medical College at Thomas Jefferson University, here with Dr. Deppak Bhatt, the director of Mount Sinai Heart, who also serves as the Dr. Valentin Fuster Professor of Cardiovascular Medicine, and we're here to talk about preventive cardiology. Thank you so much for taking the time to talk this morning, Dr. Bhatt.
Great to be with you.
Thank you. So opening up, just wanted to get your thoughts on really what you thought the ideal situation moving forward in preventative cardiology would be in terms of imaging and AI use.
Yeah, it's a great question. I think that prevention is hot. Prevention of ischemic events, prevention of heart failure also catching on. So the whole concept of prevention in cardiology, I think, will be even more central in years to come. As far as what you asked, what might the role of, say, AI and imaging be? I think imaging is actually going to be a big part of prevention, and I think AI is going to be a big part of imaging. Not to the point where it actually makes physicians obsolete. I don't think that's going to happen, but rather to augment what physicians do. AI is particularly useful at looking at patterns that the human eye and the human brain just can't perceive by using massive sources of data. So I'm really optimistic about the marriage of AI, imaging, and prevention in the years to come.
Wow, really great answer. Thank you for your thoughts on that. And then I know that you have recently announced a new trial, the Transform trial, that really looks at what you were just talking about. Would you be able to discuss that a little bit further?
Yeah, absolutely. So CT coronary angiography is really taking off. There's lots of data to support it. For example, in patients presenting with chest pain, the most recent ACC chest pain guidelines actually do recommend the use in appropriate patients of CT angio. So that's a pretty clear indication. But what about in the primary prevention setting? Should we be using coronary CT angio to screen for coronary artery disease the way we use colonoscopy to screen for colon cancer? That's an unanswered question. The data for colonoscopy for colon cancer screening is terrific, and that's why guidelines recommend it. But what about coronary artery disease? There's a lot of it out there. Most people are asymptomatic, but a lot of them do end up having cardiovascular complications, dying from cardiovascular causes. Sudden out-of-hospital cardiac death is a big problem. So is there a way we can identify patients in the primary prevention universe before they run into problems? Well, that's what the Transform trial is all about. It's a prospective randomized 7,500 patient trial to see if staging coronary plaque using CT coronary angio and an artificial intelligence augmented algorithm is able to more clearly delineate patient risk than, say, current ACC risk scores or other risk scores. And then does that knowledge allow us to tailor, to intensify medical therapy to actually reduce ischemic events? And if the trial is positive, it'll be a few years, but if the trial is positive, well, it'll transform the way we do primary prevention. And if it's negative, it probably means we shouldn't just do a bunch of screening coronary CT angios on healthy asymptomatic people.
Okay, wow, a very well-named trial then for the goals of what it could potentially do for medicine. A question with that, so if it were to be found positive, how do you think that we would overcome some of the challenges in getting asymptomatic patients to come in and get their hearts checked out, even though they don't really think they have any heart disease?
Well, that's a terrific question. I think for things like colonoscopy, a lot of people don't get the colonoscopy because they perceive it as being uncomfortable. Though there are ways of testing the stool and other fancier tests that are less invasive. But in the coronary artery disease world, I think patients would actually be really receptive to it. I'm going to say in New York, we've got patients coming in and asking for CT angio. So I'm not sure patient adoption would necessarily be so bad. I think if there's actual randomized clinical data supporting the practice, if guidelines then adopt the practice and endorse it, I think patients will be really enthusiastic about getting tested out. Maybe not everybody, but I think that a lot of times, if a patient sees that they've got plaque, that might be a motivating factor that might improve adherence with medical therapy. But again, these are all things we're going to test.
Yeah. Okay, a lot of things for us to figure out in the future, but it seems like there's a lot of good work being done. One last question, I guess, for any trainees like myself, students, residents, fellows, what things do you think we can do best to educate ourselves on preventative medicine, preventative cardiology, and any specific aspects of our training that you think we should focus on or look into?
It's a great question. There are a lot of different ways I could go with that, but maybe since you framed it around prevention, I'd say, always think about prevention in your patients, even if you're a subspecialist or a subspecialist, like an interventional cardiologist. Doesn't mean that prevention isn't important. Have to look at the whole patient, and even if they came in with an ischemic event, a heart failure event, really want to think about what you can do to prevent further cardiovascular events. I think as we're thinking about prevention for our patients, though, we should also think about prevention for ourselves, for our colleagues. I think a lot of times doctors, whether they're older, whether they're younger, trainees, we don't really necessarily take the best care. Well, you look like you take good care of yourself, but in general, I don't know that we all take great care of ourselves, whether it's diet, exercise, enough sleep. And that's easier said than done. I mean, if you're a medical student, a house officer, life's busy, but as an attending, actually, it's also pretty busy. So I think it's important as we're preaching prevention to try to some extent to practice it for our own health and the health of our colleagues.
Wow, really great advice, thank you. I definitely will continue trying to take care of myself too, as it seems that you do as well. Thank you so much for your time here, taking the time to talk to us at Fits on the Go. Really appreciate it.
Yeah, wonderful speaking with you. Thank you.
You too.